This video is a little bit my personal story and what kind of hormone replacement therapy I'm using. I am over 40. I am perimenopausal, and for 1.5 years ago, I have had a severe burnout, and I was thinking that I was working a lot. Always the case, every woman, not just me. We are working a lot. We are taking care of our kids, our families. We are resilient. We are not thinking about ourselves. It's not just my story. That is actually every woman's story. But for me, it was a severe burnout that I couldn't feel myself. I'm getting a little bit emotional. I could just do one thing. I could just make the food, and I had to rest the rest of the day, lay in bed, and I couldn't do anything else. So I did a lot of research as doctor, perimenopause. It was not much information about that. And medicine, you are not learning about preventive treatments. You are learning to treat diseases most of the time. But I get a little bit help of my colleagues, and we were thinking maybe this is my hormones that are fluctuating. My blood tests were absolutely normal. I did my research, and I knew that I was a perimenopause state. I started taking hormones, and it did day and night different for me. That's why I'm advocating, and I am telling other women who doesn't know about this. What I am enough about me now. I will share what I am taking today. Estradiol, the most important reproduction hormone, is not just a reproduction hormone. I said in my previous videos, it affects your bone, your heart, your brain, your libido, everything in a woman's body. So I started with 0.25. Now I'm in 0.75 estradiol. I use 1 patch a day. It looks like that. Tearing this up, there is a tiny patch. A lot of people say don't touch it, but I don't care. You're putting it under your belly in your stomach. Doesn't matter where, twice a week. So I will do that. Put it here. So this was the estradiol. Twice a week I use that. Because I have a uterus, I am using also progesterone, 100 grams of progesterone once before I go to sleep. It looks like that. 100 milligram is working great for me, and I'm sleeping better. I'm feeling much better. The recommendation is 200 milligram for postmenopausal women. Essential. And I use testosterone. It's a gel. You use 1 pump in an area which doesn't have any hair, not in your joints, but just somewhere here, for example, in your thigh, calf, anywhere you want, just 1 pump. At the same time, every day. The effect is coming actually, for some women it comes immediately, for some women it takes weeks or months. Just bear with testosterone. You start slow and you wait. What more I use? Magnesium glycinate. Before I go to sleep, I take it with progesterone tablets actually. You can sleep better with that, and your gut will thank you. I use omega-3 capsules. I take 1 capsule every day. Good for your heart health and for your brain. And sometimes when I don't use the magnesium glycinate, I use the magnesium plus vitamin B6 for a better health, basically. Besides these medications, I also changed my diet absolutely. I'm focusing on protein, fibers, a lot less carbs, because carbs are not essentials actually. I'm not saying that you should not take any carbs, but please, if you focus on your protein, healthy fat, and fiber, you're good. I'm focusing on my training. I'm taking it at my pace. I used to strength train a lot. Now, because of the burnout symptoms, I am taking it easy. I do 3 times a week the strength training. I walk a lot. I have a treadmill at home. I do that every day, at least 10,000 steps every day. Nutrition is also very important alongside the hormone therapy. One thing more I have to recommend is that don't take refined food, refined sugar, white flour, white rice. If you cut sugar, you come across a lot of things that has sugar. You're not eating it, and you will feel much better. Trust me on this one. This was my short regime of hormones and supplements. Nutrition is the most important part, as much important as the hormone therapy.